I gave you our very exciting new 2016 physician directory. So please take that home with you. Great information there. You have a surgery at Williamson Medical Center handout. It gives you all the information about our surgery center at the hospital. And then on the back of it, it gives you a few of our Williamson Medical Group physicians that are accepting new patients. And then it tells you how they can be reached. So please take that home with you as well. And then you have a note sheet to take any notes from Dr. Tissot's presentation. And you have a program evaluation that will help us determine future programming for the fountain. So please fill that out at the end. And then let me introduce Dr. Tissot. Dr. Tissot is a urologist who received his medical degree from the Medical College of Ohio. He completed his general surgery internship and urology residency at William Beaumont Hospital, where he became chief urology resident. He currently practices at Urology Associates, which is located near Williamson Medical Center. So please help me welcome Dr. Tissot.
All right. Well, thank you guys and girls for coming. We're going to talk a little bit about overactive bladder. Urologists deal with a lot of different things. I'm going to get out of the way so you can see over here. We deal with anything ranging from cancer to incontinence to kidney stones and everything in between. Today's talk is a little bit is about overactive bladder. That is basically leaking urine when you don't want to, or having the sudden urge to urinate. So, start with a little cartoon which describes these symptoms that, get out of my way, I gotta run to the bathroom as fast as possible or I'm gonna knock you over. And so, what is overactive bladder? We abbreviate it as OAB. And it is a combination of multiple different symptoms that people have either one of them or none of them, and they include urgency. You can have leakage of urine or incontinence. You can usually have frequency and nocturia. Nocturia is going to the bathroom at night. It was a very busy slide, but it summarizes again some of the symptoms. Frequency. A normal, quote-unquote, normal person should not go to the bathroom more than 8 times in a day. If you go more, you have some frequency issues. Nocturia is getting up at night. You shouldn't get up more than 2 times at night to urinate. When you get up more than twice, it can disrupt your sleep, and it can be very distracting for your sleep. Urgency. Urgency is that sudden urge to urinate. That, oh my gosh, here it comes, I gotta get to the bathroom right away. And then urgent incontinence. That's the leakage of urine if you don't get to the bathroom in time. You're on your way and out comes the urine before you get there. All of these symptoms, some of them or none of them, people have that can make up this overactive bladder. Again, a very busy slide, and I apologize about that, but this talks about the different types of incontinence or leakage of urine. There's 3 main types. Number 1 is called urge incontinence. That occurs again if you don't get to the bathroom in time. The other is called stress incontinence. That is when you leak urine when you cough or sneeze or pick up something heavy. And then there's something called mixed incontinence. That is a combination of both. People can have both types of leakage. And it's important to decide which kind of leakage you have because the treatments are completely different. Overactive bladder is a spectrum of many different symptoms. This is kind of just a repeat of what we saw earlier, that there are frequency, getting up at night, going urgently to the restroom, having leakage. So it's a spectrum. You don't have to have just one or another symptom. You can have all of them or a couple of them. Now, this is a very interesting slide. Basically, it states that overactive bladder is more common in the United States than asthma, than diabetes, than osteoporosis, than Alzheimer's disease. Over 37 million men and women in the United States have overactive bladder. Because it has to do with urine, people are embarrassed to talk about it, and so they don't oftentimes bring it up to their physician, and therefore it gets neglected. But it is an extremely common ailment that a lot of us are going to have. Again, this is just a little pie graph that shows 37 million people in our country have overactive bladder. And there's two types of overactive bladder. One where you leak urine, and we call that wet, or one where you don't leak urine, and that is called dry. And the majority of the population that has overactive bladder just has the urgency and the frequency and the getting up at night. They don't necessarily have the leakage, although about a third do. Now, getting more mature is what I like to say, or getting older, we see a prevalence increase of overactive bladder like we do with a lot of other health issues, such that about a third of men and women over the age of 75, actually over the age of 65, have some sort of urinary problems, whether it's the urgency and the frequency. So that's a pretty large population, and as we become older. Now, a lot of people have these symptoms and say, oh, I can handle it on my own. I don't need to see a doctor. I'm too embarrassed. So they try to manage it by decreasing the amount of fluid they drink. Well, if I don't drink a lot, I'm not going to pee a lot. Well, that's not necessarily true. They may try wearing pads to just stop the embarrassment of the leakage. They can also go to the bathroom frequently, trying to ward off the leakage issues. Now, 2/3 of patients actually have problems or symptoms for over 2 years before they actually see their doctor about it. Now, they may see their doctor about blood pressure issues or cholesterol issues or a runny nose. But most patients don't talk to their doctors about the leakage of urine, and we'll talk about why in a few minutes. And actually, only about 30% of people that saw their doctor actually proceeded on with evaluation for their bladder symptoms, which again can be very bothersome for patients. So here's some things that we hear, or I hear when I go out and give talks on this. Why people are not interested in talking to their doctor about the leakage of urine or the urgency. It's part of getting older, it's part of everyday life, I'm fine with it. It's not bothersome enough to really treat it, or I'm very, very embarrassed of my leakage, and therefore I don't want to talk to anybody about it. Or there's no treatments that can really help me out there. Well, I beg to differ with all of these. All of these are incorrect statements. There are treatments that can help, and we're going to talk about them. It may be embarrassing to you, but it's something I hear in my office 10 times a day. And your primary care doctor hears about it often. And as far as severity, if it bothers you enough to keep you up at night, or you have to change pads, then it's bothersome enough to possibly address. And yes, as we saw in the graph, it is part of getting older, but it doesn't mean we have to neglect it or ignore it if it does bother us. So, the question is, do you have problems in your bladder that are bothersome, or do you ever leak urine? And if the answer is yes, raise your hand, then you should and/or go see either your primary care doctor or your urologist that can help discuss the options that you have. So there's a little slide I like to put in there. See how to break it up a little bit. So the toothbrush says, sometimes I feel I have the worst job in the world, and the toilet paper says, yeah, right. So we're going to talk about some options that you have for overactive bladder. And they include behavior therapy. They include taking medications. There's a combination of therapy where you can combine both the behaviors and the medications. Then there's procedures that we can do. And they include something called InterStim, which is a bladder pacemaker. They include something called Botox. A lot of people are familiar with that for your face, but we put that in the bladder. And then something called PTNS. That is basically an acupuncture needle that goes into an ankle nerve that stimulates your bladder. And we'll talk about that too. And then there's some major surgery that we also do, but it's pretty rare that we need to do that in today's times. Alright, I usually start with behaviors because you can start with the most conservative and work your way up to surgeries and operations. So usually when someone comes in initially, we try something called delayed voiding, trying to get the bladder to hold on to more urine, and we retrain it. We talk about diet things. There's things that we take in our diet on a regular basis that can cause our bladder to have urgency and frequency and leakage. And that includes caffeine. Caffeine is a big stimulator of the bladder. And with that comes going to the bathroom frequently and urgently. Now, most people don't know this, but caffeine comes in the form of coffee, tea, soda, and chocolate. And 1 cup of coffee, no one here drinks 1 cup. We're all drinking grandes and ventis and big old cups of coffee, has enough caffeine in it to last 8 hours. So that 1 cup of coffee you have in the morning is still with you in the early afternoon, making you run to the bathroom frequently and urgently. So oftentimes we're able to tweak your diet and your symptoms go away. There's physical therapy exercises we can do to help with this, and then we do some time voiding things as well. So we start with the behaviors before we rush and do medications. There are a whole bunch of medicines that are available to us that help with the frequency, the urgency, the leakage, and getting up at night. There's some that are generic, there's some that are name brand. The majority of them are in a class of medicines called anticholinergics. And then there's a new type of medicine that is in a different class. We all know medications have side effects. And so that's part of the problem with medicines. And this class of medicines are very effective for a lot of patients. However, they can also cause a lot of side effects. The side effects for this group of medicines, typically the big 3 include dry mouth, dry eyes, and constipation. And nobody wants any of those 3. Now, some of the other things that can affect is it can make you drowsy. It can be a sedative. You can have some hallucinations with some of these medications. You can have memory issues that can cause confusion and delirium. We already talked about the sweating and saliva, and in some patients it actually works so well you have a hard time peeing. It works. We're trying to decrease the number of frequencies, the frequency of voiding you have, but it works so well that we decrease it completely, and that's a problem. So again, this one I don't know if you'll be able to see, there's a giant pill the pharmacist is giving the patient. It says each capsule contains your medication plus a treatment for the side effects. Which is true in today's time. You take so many pills that you gotta take something else for the side effect. Alright. So this is a very happy lady and her daughter because they just had something called the InterStim. The InterStim device is a bladder pacemaker. It is a great procedure that helps patients where behaviors don't help them with their symptoms, where medications don't help, or where they can't take medications because of the side effects. What this InterStim is we do a test in the office that takes about 15 minutes. And I place a little electrode that goes right next to the nerves that control the bladder. And then you wear this little thing on your waistband for about 3 days. And it controls these electrodes. And that controls your bladder symptoms. You come in the office in a couple days and we take that electrodes out and you tell me how great you feel. Is this the best thing since sliced bread? Or it really didn't do much for you? And then, if it works really, really well, then we're able to do a procedure in the operating room where we actually bury everything under the skin, so there's nothing hanging out. But this is a very effective way to help overactive bladder when some other options fail. Some of the more conservative options fail. This goes through the test a little bit that I just verbally said. I want to go back because I want to talk about the two other options here. The other one is Botox. Now, Botox is becoming more and more popular, and most people, like I said, are familiar with it with your face. But we're able to inject it into the bladder, and it relaxes the bladder muscles. And by relaxing the bladder muscles, your urgency, your frequency, your leakage, your getting up at night, all can decrease. And it is very effective. I have done it lots of times. The issue with Botox is it doesn't last forever. Just like if you do Botox in your face, it only lasts for about 6 to 9 months. Now, I do have a couple of patients I've done this on and it's lasted for 2 years, about 24 months, and then we have to repeat it. But it's a procedure that can be done in the office. It takes less than 5 minutes to do it. And there's no general anesthesia, so we don't have to worry about going to sleep or anything like that. This last thing is called PTNS, fancy word for posterior tibial nerve stimulation. Basically, it is putting a little acupuncture needle in an ankle nerve, right in your ankle. And it stimulates this nerve for about 30 minutes. And this is done in my office. You leave, you come back home, you go out to eat, you go shopping, whatever. And you do this once a week for 12 weeks. And by stimulating this nerve, it shares the bladder nerve as well. And it retrains the bladder nerve such that the bladder muscle doesn't have the urgency, the frequency, and the getting up at night anymore. And then once a month, you need to come in for a touch-up. We put the little electrode in your ankle, you bring your book, you bring your knitting, you bring your Sudoku, and you just sit there for a half hour, and then you leave. It's very effective for a lot of patients that, again, may not want surgery, where medicines may not work. And then there's major surgery, but we rarely do that anymore, and that involves removing the entire bladder and building a new one, and that is not something that's done very often. It's pretty rare we have to do that. So, basically, in summary again, overactive bladder, which is again, going to the bathroom frequently, urgently, getting up at night, sometimes leaking, is a very common problem. Yes, as we get more mature or older, we do have a higher risk of developing it, but it is not normal to have this. There are lots of options that we have available to us to help patients, again, ranging from just changing your diet and your behaviors, all the way up to surgeries. And then I stress with everybody that if you have these symptoms and are bothered by them, that you talk to your doctor about it. If you have these symptoms and you're not bothered by it, then you don't necessarily have to address it. But if you are bothered, then I do encourage you to see your primary care doctor, or you can see a urologist. who will be able to help you with some of these options and treatments. And my last little slide, this is an incontinence hotline, so please hold, which is really hard for someone to do who has to go to the bathroom frequently. Questions that anybody may have. And we all have friends, so you may not have a problem, but your friend may have a problem. So you can talk about your friend if you don't want to talk about yourself.
Are you asking questions?
Yes, sir. Fire away.
Did we find out what I take on now? I'm really getting treated at the VA.
Absolutely. You are on one of the medications.
That's
Yep. It's called Urologist. That's the one you're on right there. And that helps with those symptoms that we just talked about.
doesn't help much.
Doesn't help much. Right. And that's where there are other medicines that you can try. You can try the behaviors. And then there's always some procedures that are optional as well. But typically I would try a couple different medications, so next time you're at the VA, I'd love to know and say, hey, this Urologist, it's not working. What else do you have? Okay? Because I would experiment with some medicines before I talk about procedures or anything. Okay? But you're already on one of those.
Thank you.
You're welcome. Yes, sir.
How does tea compare with coffee?
So, how does tea compare to coffee? Coffee typically has more caffeine than tea. But sweet tea, which is a drink of the South, I'm from up north, so I'm not really familiar with it until I moved here 10 years ago. But sweet tea does, and tea in general, does have caffeine in it. You have to and each brand has a different amount. You would have to actually read the back of the container or the label. But tea is a big proponent of caffeine. And on a side note, too much caffeine causes kidney stones, and then I'd be happy to see in the office for the kidney stones that you develop because of all your tea that you drink. So, yeah. Any other questions? Yes, sir. Fire away.
I sometimes have a problem between having enough water in my body and having too much water in my body. I get very dry mouth. I keep more or less in balance most of the time. But I'm not drinking anything after about 3 o'clock in the afternoon. But I sometimes do that and wake up with very, very dry mouth.
So, what we usually recommend is you drink, whatever time you go to bed, you want to stop drinking about 3 to 4 hours prior to going to bed. So you go to bed at 9 o'clock. You want to stop drinking about 6 or, let me say 5 to 6. That gives your kidneys, our kidneys take 3 to 4 hours to take what we drink, process it, turn it into urine, and then we expel it. So, what you can do is rather than dehydrate yourself in the afternoon, watch what you drink. I would not drink tea at lunchtime, because we talked earlier that caffeine at lunchtime will stick with you till 8 o'clock at night. Don't have tea at 3 o'clock. But you can, and don't have tea at dinner for sure. But you can drink up until 3 to 4 hours before you go to bed, and that may decrease the number of times you get up at night to go pee.
Does water not do the same thing?
Water does. Any fluid we process, water, any liquid is going to get filtered by the kidneys and put into the bladder. But water doesn't have, it's not caffeine. Caffeine stimulates our bladder muscle. Caffeine also works like a diuretic. And a lot of you are probably already on a water pill, Lasix or something like that. And the caffeine works like a water pill, so it causes our bladder to fill up faster as well. So it does 2 things. It's a bladder stimulator and acts as a water pill. But straight up water won't cause you to make more urine. But our body only needs so much water, so if you drink a gallon of water, you're going to be peeing to get rid of what you don't need. like, as far as drink wise,
What?
like, just the drinks that are non-sugar? Or you just,
Or put something in your tea that's not sugar.
It doesn't matter, the sugar's not the issue, it's the caffeine. So you can find caffeine-free teas, I know they make those. Decaf, here's the other thing, decaf coffee still has caffeine in it, it's just a lot less. It's not caffeine-free coffee, it's just decreased caffeine. So if you can find caffeine-free teas, and you can put, I don't want to encourage diabetes, put all the sugar you want in it, but the sugar is not going to have an effect necessarily with the urination, unless you have diabetes, so that's a different story. Yes, ma'am?
I had 2 bladder operations when it's fallen, and neither one of them done what they were supposed to do. I do take a ditropen, the,
Yeah.
I can't think, what am I trying to say?
Oxybutynin is generic.
Yeah,
Yeah.
generic, that's what I'm trying to say. Anyway, but I'm a good sweet, and I do like my coffee. That, what I'm trying to say is that I have runs on me today. I will definitely check that.
Yeah.
Because I moved up all of everything you said back from
It is. It's a very common problem, and simply by tweaking some of our behaviors and our diet, we can improve it. We may not cure you, but maybe we'll cut it back dramatically. That can help.
That's very good.
Good. Anything else? Well, I appreciate everyone coming, and if you guys have any questions, I'll stick around for a few, and thank you very much.